Hello viewers, this is Health Now Show, your health friend. With me, Jane Kariuki. I am a counseling psychologist. And today, this session, I'm very excited. You can see it on my face. I'm very excited because of the topic that we are going to have today. And this is about us, about our lives. As we say on this show, that this show is geared towards sensitizing you, educating you, creating awareness on various issues touching on our health. And that is why when we have been talking about, in our past episodes, we've been talking about losses. And the losses that we have been talking about are different. Loss of a loved one, loss of a body part, loss of a pet, loss of a job, and many, many others. And we heard you. You told us from your feedback that you would like us to also bring in doctors, medical professionals that can be able to sensitize us, that can be able to give us some tips on how we are going to go on and become healthier people. We've been bringing psychologists, mental health professionals, but today we are going to have a gynecologist. And our topic for today is uterus issues. Ladies out there, you are so much aware of issues that come in because of having that major organ in our body. And when we talk about loss of a body part, loss of an organ, we know there are kidneys, we lose our legs, there are many areas many organs that we lose. But before we get into that very important organ, that is the uterus, we will look at the whole lady, the whole woman, so that we know where does this all start. What are some of the things that bring about this loss? Gentlemen, you are not left behind because we live in families, we live in our workplaces together, we work together. We know when this lady is also going through a lot of challenges, a lot of issues. And here, I would also call for us to support. And to take us through this today, my viewer, very excited. I will pause there because I'm very excited because we are going to learn so much. And to take us through today is Dr. Mary Maina. She's going to introduce herself further so that we can get to know her and what she does, and she'll take us through this very important session. Karibu Daktari.
Thank you so much, Jane, and Thank you for having me. I'm excited to do this with you because I can see the passion in you. Yes, my name is Dr. Mary Maina. I am a consultant gynecologist. I work at Kiambu Doctors Plaza. And basically, a gynecologist deals with the reproductive system of women. So today we are going to discuss the issues that affect the reproductive organs in a woman. Thank you.
Thank you so much.
Yes.
And probably just to ask,
Yes.
How long have you been in this reproductive work? Helping women?
Okay. I have been a gynecologist for the last 7 years.
Yeah.
And I have been a doctor for the last 13 years.
Wow.
Yes.
So you have a full package in terms of your experience.
Yes, I think I have enough experience to be able to discuss this with you.
Yeah, okay. Thank you so much for coming.
Thank you.
We are really honored.
Thank you.
Now to start it off.
Yes.
When we talk about a uterus, we talk about this woman. We can't separate her from this very important body part. Kindly define for us, what is this uterus? And so that we can move on.
Okay, thank you so much. So the uterus is one of the internal reproductive organs in a woman. So the reproductive organs in a woman are divided into internal and external. External is what we can see, internal is what we cannot see. The internal organs are basically the ovaries, the tubes, the fallopian tubes, the uterus, and the cervix. So the uterus is the one that has two roles in the body. and its work is to carry a pregnancy, and the other job is it's the one that gives women their monthly period. So the uterus has those two uses in the body, carry a pregnancy and give a woman her monthly period.
Okay.
Yes.
So I'll come to that later on, because you've talked about the monthly period, so that we see even further.
Yes.
So kindly define for us what are these other uterus issues that may arise in the lifetime of a woman.
Okay. So the uterus can have what we call congenital issues, meaning you're born with it. It's something that you don't have control over. It is the way God made you. And then we have other diseases that are acquired. Okay, so those are diseases that will be acquired at different stages in a woman's life. So there are those that the younger woman will have, there are those that the middle-aged woman will have, and there are those issues that the older woman will have. So mainly for the congenital issues is something you cannot change. It's the way God made you. It's the same way God gave you 5 fingers. It's the same way he could make your uterus to maybe not be normal. Okay? So those are the congenital issues. And generally we have people who may have congenital absence of a uterus. Okay. So there are women who may be born without a uterus. They're not common, but they're there. Okay. So generally in the general population, if you took the general population in the world, about 0.5 to about 7% of women will be born without a uterus. Okay. So there are those who will be born without a uterus, and there are those who will be born without all the internal organs. Okay. So someone may be born with ovaries but no uterus. Another one will be born with no ovaries and no uterus. Okay. They are rare, as we have said, but we see them. I would say that maybe in the last 7 years or so, I see about 1 or 2 in a year. Okay. So they're actually there.
So we could be saying now like 7. 7 in a year. And that's a lot.
So they're there. So we see them. And for those ones, really, there's not much you can do. Okay? There's not much you can do. And most times we don't get to know them until a woman reaches puberty. Okay? We don't get to know them until a woman reaches puberty. So someone will come to you at 19 years and say, I am 19 and I have never had my period. So as you try to find out where the problem is when you will do the tests that we do and find that this woman actually was born without a uterus. Okay? So those are the congenital issues. The world now is trying to do transplants. So we've heard of women who had a uterine transplant to try and deal with that congenital absence of a uterus. It hasn't reached our part of the world, but yes, the West is trying to do it, and there have been a few success stories that have been reported where a woman has gone on to even have children. But that then, of course, depends on whether that woman has ovaries or not, because for the woman who does not have ovaries, then a transplant may not really help, because your hormones come from the ovary. But for the woman who has ovaries but no uterus, then the transplant can be useful. And they have actually gone on to have children of their own.
Wow.
Yes.
Wow, I think that is very encouraging.
Yes, I guess we'll get there with time.
We'll get there with time, but I'm also thinking it must also be very, very expensive.
It definitely is.
But probably that we'll talk on another day.
Yes.
Yeah, go on, kindly.
Okay.
Yeah.
Then, of course, we have the woman who is born with a uterus, but it's a uterus that may not be useful. Okay? Just the same way someone could be born with 2 legs, but one leg is shorter than the other, the same thing could happen with a uterus. So when a woman gets pregnant with a baby girl and the uterus is forming, the uterus forms from 2 sides. Okay? So you have this side and this side that over time grow and unite. Okay? So some of the things that could happen is that one side may fail to form. Okay? So you have a tiny uterus that is on one side, and sometimes it is too small to be able to carry a pregnancy. So most of those women will actually present to us with recurrent pregnancy losses. Okay, so because you get pregnant, yes, but your uterus is very small, so as the pregnancy grows, it no longer has space and it comes out. Okay, so you could have what we call a uniconnuate uterus, which is a uterus that only forms on one side. The other thing that could happen is that those two pieces may fail to unite. So you actually have a woman who has two internal organs of reproduction. So you have right from the ovaries on this side, the uterus is a tiny uterus, the cervix is a tiny cervix on one side. So they basically have two sides that failed to unite. Then you could have the one who unites, but that part in the middle fails to disappear, what we call a septum. So you have a woman who has a uterine septum, and that uterine septum will give you the same challenges of pregnancy losses, but it's better when they have united, because then there's a way we can get rid of that septum once we know that it is there, as opposed to the one whose organs did not unite. Okay, so those are generally the major issues that you could be born with. And you may want to ask, is there something I can do? Is there something I did? Unfortunately not. Unfortunately not. This is something we cannot prevent. It is not something a woman did that led to their baby girl getting those congenital malformations. So most of the times there are issues those are things that we may not do much about. But for the septum, we are able to actually dissect it out, and then your uterus becomes one big uterus that can go on to give you the two functions that we've talked about.
So that means if somebody has never become pregnant, it can never be known whether they're the one that are not separated or something like that. It can never be known.
Most of the time we will know when we are trying to investigate why is this woman getting pregnancy losses. Okay, so as we try to investigate that, then that's when we will do probably an ultrasound or do an MRI and find that the woman actually has two sides of the uterus that failed to unite. Yes.
And then how early should somebody probably do an ultrasound when they become pregnant? Because I guess this is also important.
It's actually very important, because it then helps us know what do we advise this lady. Okay, so we always say that when you're expectant, you should do your first ultrasound before 11 weeks of pregnancy. Okay, unfortunately, majority of our women come much later. They wait for 5 months. I don't know who told some people that 5 months is when you start, but we should actually do a first trimester ultrasound in the first 3 months of pregnancy, so that we are able to pick some of these things. However, I'd like to correct, to just make sure that we are aware, even when someone has a uniconnuate uterus, which is what we said is one side, if it is big enough, we've had many women deliver with one horn of a uterus. However, if it is small, then it will give you recurrent pregnancy losses. Yes.
I'm imagining sometimes the teenage mothers, some of them, like, they have not even developed properly, and then they're hiding the pregnancy, and I'm imagining what would even happen.
Yeah, it happens a lot. We see them a lot. As you're saying, they don't want people to know they're pregnant, number one, so they'll probably not come to the clinic. And unfortunately, if that is there, then they'll come to us when they are losing the pregnancy, sometimes bleeding, sometimes the bleeding is too much, we have to give them blood. We even lose some of them, teenage pregnant mothers, because probably you overstayed with the bleeding and it became too much. So we really encourage that when you know you're pregnant, try and come to the clinic the first 3 months of pregnancy.
Early enough.
Yes.
Early enough.
Yes.
We'll take a short break, Daktari.
Okay.
When we return, we're going to look at now the other issues in the uterus, so that what would make it to be removed? What would be some of the reasons or factors contributing to the removal of that uterus? And that is, we are coming right back. Our viewer, stay tuned. Welcome back, our viewer. We're still with Dr. Maina, and we'll continue.
Okay.
Daktari, tuendelee.
Okay.
Yes.
So then maybe we can now go into the acquired diseases of the uterus that may lead to loss of a uterus.
Yeah.
Okay.
Yeah.
So we'll start with a planned removal of a uterus. Okay. Because there are those diseases that are not emergency, but lead to removal of a uterus. So one of the commonest reasons why we remove a uterus is diseases like fibroids. Okay, fibroids are quite common. So fibroids are basically non-cancerous growths of the uterus. Okay, so that one tends to affect more often the middle-aged woman, the 30-something-year-old, the 40-something-year-old. Yeah? So fibroids are really common, but if we get them early, and when they're small, we don't have to remove your uterus. And that is why we are encouraging our women to actually see a gynecologist once a year. Okay, so that you get to know where your health in relation to your uterus is. Because if we find fibroids when they are small, there are other interventions that we can take that don't lead to loss of a uterus. So the other common thing is diseases like adenomyosis. Adenomyosis are diseases that cause women to have very painful periods and probably very heavy periods. Yeah? So a woman who cannot function when they are on their periods because of the pain. Yeah, so that is adenomyosis. It basically means that the uterus has 3 layers, and it means that the inner layer, which gives us periods, has grown into the other layers, and therefore it means that when you get your periods, you're bleeding into areas where you shouldn't be bleeding. So that is also quite common. And I want to say at this point, dear women, painful periods is not normal. Very painful periods is not normal. We have normalized that situation, and yet our women have issues that we need to address. So if you have very painful periods that doesn't go away on a routine painkiller, then maybe we need to find out whether there is something else. Then the other planned surgeries that we do are diseases like cancer. Okay, so cancer of the reproductive system, and unfortunately for the uterus, whether it's cancer of the ovary, cancer of the cervix, the uterus tends to go. Okay, so unless we catch you when you're in stage 1, where we can preserve the uterus, if you have any cancer of the reproductive system, and we say the reproductive system is the ovaries, the uterus, the fallopian tube, and the cervix.
Yes.
If we find any advanced cancer in any of those organs, we end up removing your uterus.
Together with the rest of the other organs.
Yes, so we will remove whichever organ has the disease plus your uterus. Okay, but if we catch the disease, the cancer early, like in stage 1, we don't have to remove all those other organs. We will remove the organ that is affected. And that is why, again, visit your gynecologist once a year, get checked, so that if there's a problem, then we catch that problem in good time. Okay? Yeah, then we also have other precancer diseases. So precancer meaning, luckily, we've caught you early enough. But for some women who maybe have finished their reproductive career, meaning I no longer want babies, and I have a condition that could lead to cancer if it is not treated, then most of them will opt to have their uterus removed. However, for the younger woman, if we catch you 28 years, you still want to have more babies, you have a disease that could eventually lead to cancer, most times we advise that we just remove the part that is affected by that precancer lesion and leave the rest of your reproductive system intact so that you can go ahead to have children. Then other diseases include things like, for the older woman, is uterine prolapse. So uterine prolapse basically means the uterus is supposed to be inside your what the layman would call stomach, but I would call it abdomen. It's supposed to be inside your abdomen, together with your intestines. But there are some situations that arise where the uterus comes out. Okay, it moves from where it's supposed to be and it comes down. That is more common in older women, especially women who maybe had many children, women who may have had difficult deliveries, women who may have other diseases of the connective tissue, because the connective tissue is what supports the uterus up there. So you find women who maybe have diseases like lupus may eventually get uterine prolapse because their connective tissue is not as strong as it should be. And most times, for the younger woman, if that happens, because it can happen when you've had a very difficult delivery, we will try to see if we can suspend it back. Okay, there are ways we can suspend it back because you still want to have children. But for the older women, most times they will opt to have it removed, because they say, I have finished having children. I no longer, and this thing is disturbing me. I no longer want to have it inside. You can as well remove it. So those are some of the reasons why we plan, we schedule a surgery, meaning it's not an emergency, but this is something that we have planned with you, that on this and this day, we will remove your uterus. Okay, so we give you time to think about it,
because it's not an easy thing. It's not an easy thing. And probably before we leave the prolapse, or the going down of the uterus, let me just use the layman's language, when it comes down, what are some of the contributing factors associated with this movement?
Okay, so I've already mentioned one is age. Number two is difficult deliveries. Women who maybe have had a difficult delivery at one point. The other thing is women who have a chronic cough, meaning a cough that has gone on for a long time for one reason or the other. So probably you've had tuberculosis that has not been diagnosed for a long time, and you have been coughing for a long time. So what that does, it increases the pressure in the abdomen, and that pressure will push things that can go down. So if something can go down, that pressure will make it go down. So there are other chronic infections of the lungs that will actually give you a chronic cough and eventually lead to a uterine prolapse. Two very unrelated things. But
imagine.
Yes, but it can happen.
You cannot even think.
Yes, it can happen. And we have seen it happen many times. Then the other thing is women who have chronic constipation. Okay. So you have chronic constipation, meaning when you go to the toilet, you have to put in a lot of pressure. Okay, so that pressure could also lead to a uterine prolapse. And that is why we encourage you, please eat a lot of vegetables, a lot of fruits, take a lot of water so that you don't have constipation, because you may have the constipation in your 30s, and then when you're 50, you have a uterine prolapse and you do not understand where this came from. But actually it's from the constipation you had 20 years ago. It weakened your pelvic floor, which is what supports all those organs up. So once your pelvic floor is weak, then things just start falling where they shouldn't be falling.
A curiosity question.
Yes, Jane.
How would I know that my uterus has, the prolapse has gone down, has moved down?
Okay, thank you for that question. So usually the woman will actually come and tell you, there's something, I feel something that is coming out and going back. Because initially it will come out like when you're standing, then when you sit, the pressure is not there. Okay, you feel a bit of relief when you sit or you lie down, but when you stand, you can actually feel there's something. And then most of them will tell you, especially when I go to the toilet, okay? Because the minute you put in a bit of pressure, everything just comes down, Others will actually see it, Okay, it has 4 stages. So when it is at stage 4, it's actually out permanently in between your legs. So you can actually see it, you can touch it, you can push it back. Yeah, so most women will actually feel it and tell you, there's something that I'm feeling where it shouldn't be.
I'm feeling it even as I walk?
Yes, you can. Yes, you feel it in between.
And then it can drop out?
No, it cannot fall. It can't fall out completely because it's still
forgive
suspended.
My ignorance.
No. That's why we are here, so that we enlighten each other. So it cannot completely fall off to the floor because it is still attached to your pelvic bone. Okay, it's just that the attachment is now loose and it is hanging. Okay,
but it will be a nuisance.
Of course, it is a nuisance, and most women will actually come because it's irritating being there. So it's something that you're not used to having in between, but the minute it's there, you will know. You will actually know that there's something.
Okay.
Yes.
Yes.
Okay.
Yes.
So those are generally some of the reasons why we do what we call an elective surgery or a planned surgery. And then there are the emergency surgeries that lead to loss of a uterus. Very distressing because you probably haven't had time to think about it. Okay. So some of the reasons, mainly this happens with labor and delivery. Okay. So one of the commonest reasons why we remove a uterus in an emergency situation is when a woman gives birth but cannot stop bleeding. Okay. So you have delivered and the blood won't just stop coming out. So we've tried everything else. Of course, it's usually the last resort. There are many medications that we use to try and stop the bleeding. There are even other surgical interventions that leave your uterus intact that may work. But there are situations where you do all that and the uterus will not stop bleeding. And you know, it's so distressing because this could be a 21-year-old, could be a 19-year-old, could be maybe has had a baby who has not even survived, but you're in a situation where you need to save the mother's life.
True.
So that is one of the commonest reasons why we end up removing a uterus in an emergency.
I'm imagining that that is why sometimes when you go to deliver in a hospital, you're given a period of time, kind of observation, some hours, and I'm looking at somebody who is delivering at home. And the bleeding comes in.
Yes. Most of those ones we even lose them because by the time they get to the hospital, they probably have bled so much. And there's not much you can do. And as you say, you're correct. Every woman after delivery, we keep them for 24 hours in the hospital for a reason. Because the first 24 hours is the most critical period after delivery. A lot of things can go wrong. And if you're at home, then you may not know when things are going wrong. So for every woman we deliver in the hospital, 24 hours is observation so that we see whether there's anything that will go wrong. And the commonest is actually bleeding. And in fact, bleeding after delivery is a leading cause of death in women around the time of delivery. So that could lead us to remove a uterus. The other thing is what we call a ruptured uterus, again in pregnant women, mainly who deliver at home. Okay, it's very rare for a ruptured uterus to happen in the hospital. We are always on the lookout. So this happens for women, especially who have had a cesarean section before, and then you try labor at home. Okay, because remember, every time you have a cesarean section, there's a weak point. So that weak point could easily give way. So the other reason you can get a ruptured uterus is if your baby is not lying in the correct position. Let's say you're trying to labor and your baby is lying across instead of up down. So the head is on the side and you're trying to labor at home. That could also cause a ruptured uterus, and sometimes we are not able to repair. Most times we repair the uterus, but sometimes depending on the nature of the rupture, we are not able to repair.
Daktari,
yes.
We'll pause there.
Okay.
This first part, we cannot complete all this, but I would want us to stop there. Next week, we are continuing with part 2 of this so that we can look at closely. We'll just continue with the part 2. Then we look at it closely and then we see what can be done to help our viewer who is watching us. And thank you so much. We are continuing part 2 of this. Thank you.